Impact Leadership by Omdena is a series supporting and promoting thoughtful and sustainable leadership with a focus on building solutions to solve some of the most pressing problems of the world. In Impact Leadership by Omdena, we bring together the civic society world and the tech world to discuss and create the impact for a better future. Rudrada Mitra, CEO of Omdena, is the host of the series. Subscribe to our Impact Leadership newsletter on Omdena's website to be notified about new pieces of meaningful content.
Today, we are glad to have Janti Soeripto, who is the CEO of Save the Children. Thank you for joining, and I'm glad to have you in the Omdena Impact Leadership series. Let's start with your journey. And I learned that you started your career working in Unilever and then moved to Save the Children. So I'm quite keen to learn from you that what made you move to an NGO from a corporation and what differences that you saw between working in a corporation and working in an NGO.
Well, thank you for having me, Ru, and thank you for everything your organization has done with and for us helping children, first and foremost. I worked for Unilever for a long time, and I think at a certain point, after 15 years or so, I just thought, am I going to do this for another 20 or 25 years? Is there a way to have more of a direct impact on people in this world who are less fortunate or where inequality and discrimination is having a real impact on their ability to develop their potential? And then I found it was actually quite hard to get into this into the development and humanitarian sector because, when you're not in it, it's hard to figure out where to begin, who to talk to. I literally just started talking to a bit of a random list of my network. And then I was sort of lucky because, a headhunter approached me about a job in Save the Children in 2011, I think. And that's how I sort of rolled into it. So I wouldn't say, I'd like to pretend that this was a very designed sort of step, but it really wasn't. And look, in terms of the differences, people ask me that a lot. I always say that I think there are many more similarities than there are differences between what I used to do in consumer packaged goods than versus what we do here. I think, if you're large global organizations, you have to, getting and retaining great people are critical to your ability to deliver great products and services to your consumers. One of the biggest differences, I think, is that our consumers, so the people we aim to serve, have a lot less power than consumers had in the case of Unilever. If they didn't like the product, they would walk away and buy somebody else's product. And unfortunately, the communities that we serve often do not have that choice. In a way, I wish they had, because I think it would be good. It would be good for organizations like ours to have that external validation or feedback mechanism in our services. We now create feedback mechanisms, of course we do, but there is a power and difference there between our consumers and the consumers that exist in the private sector. So that's the difference. And I think the other big difference, of course, is that we work in much more fragile context, or that is where we have a large footprint. So I have to say crisis management and risk management, I actually learned in Save the Children much more so than I learned it at Unilever.
Thanks a lot for sharing that. It's actually very interesting differences that you said, which I never thought. We will come back to the feedback mechanism maybe later on when we talk about the data and how potentially such kind of feedback mechanism could be utilized using data and the new technologies. And also that you did talk about that NGO, that the users don't have a choice, while in a Unilever, the users or any corporation, people can move out. Do you see that somehow creates certain level of lacks in the services that an NGO is providing?
I'm not sure I call it lacks. I think, we have incredible people in the sector, not just Save the Children, who are incredibly driven by their mission, their respective missions, whether it's your mission for refugees or your mission for kids or, whoever people in humanitarian need. But I think, you do end up with your own blind spots. Inevitably, every organization does. And I think that external validation of a consumer walking away from you, even though you thought, I've launched products that we were convinced we had a fantastic product and offering. We did the market research, we did the focus groups, and ultimately it bombed. And sometimes really quickly too, or just, because we just didn't have it right. We had a blind spot. We had an assumption about how attractive it would be for a certain audience. And we have those blind spots in our work too. We have ideas about what's the best way to keep girls in school? What's the best way to sustainably help families out of poverty? What's the best way to make sure that people come back for their vaccination, their immunization schedule? And we do a lot of behavioral science in that way. What messages work best? But we don't always get it right. So that's how we, in terms of our product and services design of the intervention, we don't always get it right. And then, of course, you also have, how do you implement consistently on the ground? And do you implement in the way that it was intended? And sometimes that's also super hard because the context can change on you really quickly. Conflict can break out, sudden onset emergencies can break out, and that will require you to completely change your approach. And I think an earthquake in northwest Syria and Turkey, or the outbreak of a full-on war in Ukraine, are just two very in the news examples. But we have tens of these examples in areas which are much less visible in the public eye that are happening almost every day. So I think that makes our job in a way harder because we are to some extent less in control of those externalities, if you like. And of course, there's to some extent a more scarcity of resources. So that makes it a little different.
This is such an important point that you raised. And this is also, I personally see when building an impact startup is somehow we have to measure an impact, because for a corporation or for profit organization, it's very easy. They can create the output as profits generated. Mm-hmm. But for an NGO or anyone who is focused at impact, measuring impact is a tricky thing. And it's not that easy, actually. There are so many ways we can measure an impact.
When I first joined this sector, I also thought, well, why are these guys not, better at reporting on their impact? And it sometimes felt very fluffy. Or you have bad proxies, right? Saying, oh, we have more revenues, or we have reached more people. What does that even mean? And I think, and we still, we fall into that trap because people ask us, funders ask us, donors ask us, and then sometimes we feel we have to say something, right? And we think that any number will satisfy that question. And I think that's sometimes a trap that we fall into, right? Because not everything that counts can always be counted, right? And not all the things you can count. And I think that sometimes we have to be, we have to never, I think, give up on the desire to find better ways to measure those outcomes. And if they're really sustainable and if they really lead to sustainable change in people's lives. But sometimes we also have to be confident to say, look, if you're asking me about how many meals we've served, we can tell you that. And we're very happy to show you, to be accountable for how we spent that money, if it was meant to serve meals or to have kids in school. But if you're asking me if that changed a child's life for the next 30 years, I'm not going to pretend that I can give you that answer.
Absolutely. So I will make a step back and I will come back to this topic when we talk about the AI in data science and how can that be used. But I was also listening to your address to the Prime Minister or President of the US, Joe Biden, and you spoke about child rights, education, and violence against children. As an organization, where do you see the biggest challenges? And, for example, the focus areas of Save the Children with respect to these three topics?
Yeah, and I think the world has changed a fair amount, even in the years since that in particular inauguration. I think we see children's rights and lives, therefore, being impacted by a number of polycrises, we call them, so to speak, right? I would say one of the biggest ones, of course, has to be the negative consequences of climate change. We estimate that over 700 million children are living in countries at the highest risk of suffering impact of the climate crisis. We also know they often live in areas that are disproportionately impacted, and they had zero role in creating climate change. And every child, including our own, will inherit a planet with more frequent extreme weather events than before. So I think that to us, it impacts their livelihoods, it impacts where they live, it impacts how they live, it impacts their education, it displaces them, right? Many, many millions more people will be displaced because of the climate crisis. And we also know that children make up a disproportionate number of people that are being displaced. So that's a real issue that we see. Conflict, we've seen conflict increase. Yes, Ukraine, but also outside Ukraine. 1 in 6 children worldwide live in an area impacted by conflict, war zones, civil wars, etc. That is usually traumatic. I would say every child we work with or try to help or try to serve in some shape or other has experienced trauma. Right? So what that does to children's mental health well-being, aside from their direct sort of physical needs, is massive. And then, of course, the pandemic. There's huge lingering residual impact of disrupted education. In a number of countries, that education is actually still disrupted. But also kids missed out on school or on any form of learning, often in countries where they didn't have the benefits of fantastic Zoom or Google Classroom courses. If kids were kept at home, and there was zero connectivity to maintain any form of educational learning. And aside from the academic learning, of course, the social learning component has been massively disrupted. So educational disruption, as well as economic instability that really impacted a lot of poorer families more than wealthier families, of course, has also impacted them. We think millions more girls have been put at risk of being married off at an early age because their families just didn't have the economic resilience to cope and continue to keep their daughters in school. Many millions of kids have been put to work. And even if schools have reopened in those countries, it's been harder to get the poorest kids back into school. So those are the three things that are really impacting us. I think the other thing that we do see externally is that more people in humanitarian need. And I think it's been harder for the world to keep up the funding of those humanitarian needs. So we've seen more underfunded humanitarian responses. And it's been really hard to keep the world's attention on those crises because we swerve from earthquakes to wars. And even a topic like, Afghanistan, where I was a couple of weeks ago, there was a huge spike in interest, of course, right after the fall of Kabul in 2021. Then attention really actually went away. And it was really hard for us to maintain interest in what is still the largest humanitarian crisis in a single country on the planet. Then interest spikes back up when there's a ban on women working in December of last year. And everybody was all of a sudden very interested because the Taliban did something deeply negative. And again, already it's been hard to keep up that attention because, of course, we have, the war in Ukraine 1 year on. We have an earthquake in a country that was already impacted by more than 11 years of civil war. So it's hard to have attention for those crises, even though we need that global solidarity to maintain that interest.
Some of the numbers that you said are quite overwhelming, and there's so many crises going on around the world. As an organization, and also as an individual and CEO of the organization, how do you prioritize where to focus, where not to focus, or do you try to solve all the problems that you come across?
No, I think, look, there's a real advantage of being focused on children's rights because I think it anchors us to what needs to be in place to have rights of children fulfilled in the long run, and who are, as we call them, duty bearers for that, right? Who is responsible for helping make that happen? It's not just the communities themselves or organizations like ours. It's local governments, local authorities. It's all the stakeholders involved in ensuring that a child, grows up safely and healthy. But sometimes it's also hard because then if you're not careful, you are asked to comment or do things that, everywhere, all the time, on everything. And we can't do that. So we are making attempts to prioritize. We have external indicators to say where is deprivation for children the most intense, whereas also the biggest volume of kids affected by those deprivations. And then you have a list of countries where it is the worst place to be a child, and even within a country, regions or states where it is a worst place to be a child in that country. And we use that to make some priorities. But I'll be the first one to say, look, Save the Children is not working in a number of countries where arguably, in terms of the pure needs, statistics, we ought to be. But it is just too hard to find enough political interest and funding for those countries to do it well and to do it sustainably. So again, yes, we are in 116 countries, I think, today. And that's a lot. We're not in some of the countries that are probably some of the worst places on the planet to be a child. purely because there's not enough attention for it. And I don't think we should be going into a country if we don't have a good sense of being able to do that well.
You are listening to Impact Leadership by Omdena, where we bring together the civic society world and the tech world to discuss and create the impact for a better future. Subscribe to our Impact Leadership newsletter on Omdena's website to be notified about new pieces of meaningful content.
While giving answer, you did mention about children's rights being quite an important aspect. And in fact, my previous guest was Kailash Satyarthi, who won a Nobel Peace Prize working with children. And he actually highlights the need of rights and education very closely. And he said education is the perhaps one of the most important thing, because that will make children and parents be aware of the rights. So he was stressing a lot on the education. Coming back to another point that you raised, which was actually, I think, I haven't heard a lot about mental health, especially for children. Most of the times when I come across mental health, it's always about adults. Do you see mental health being really tackled for children? And is it a big problem that you see?
Yeah, I think it's a huge problem. And it's, look, the topic of mental health for adults and for children, I think has been hugely invisible, underfunded, in a lot of areas, still a taboo, right? And I think it's getting better. It is getting more normalized in a way. It's getting more normalized to talk about it. The need for good support for people with mental health problems is there. We've Save the Children, as one example, has been advocating for legislation, even in the US, to make sure that funding for mental health is part of how the US government provides humanitarian and development assistance, which before was actually not really a thing. And therefore, it was actually quite often missing from what was put up as activities that people felt needed funding. So even when you think about an earthquake that we saw 2 weeks ago, everybody's talking about, of course, we need shelter and water and food and, the more immediate things that come to mind when you look at those pictures. But of course, the long-lasting impact of that trauma on children as well as adults in that area is often forgotten. The long-lasting trauma of kids, Ukrainian kids now, or kids that have gone through, that were born into a Syrian civil war, is massive. And I do think, and I'm proud of that, Save the Children speaks to highlights the mental health issues of those kids. We give them a voice, we speak to them, we get them to say those things that they want to themselves, and then we report on their behalf of those issues. And we've done a number of reports on the Syrian mental health crisis, the mental health impact for kids in Ukraine, and the mental health impact on Rohingya children who've had to flee their homes a couple of years ago and are still in refugee camps now. So we do see that, and I still think it's an area that is still massively underfunded and to some extent invisible, because people, you can't see those scars of conflict and displacement and trauma as in the way that you can see homes being destroyed, schools being destroyed or damaged by all these events.
This topic is we can talk for a long time and we don't have the time, but this is something I really think that needs to be spoken more. I mean, whatever I come across, mental health is always about adults. I actually have very hardly ever heard about even talking about mental health for children, or maybe just I didn't hear it, but this is a very important topic. Coming to the point where me as a person, but also as an organization, we work a lot with AI, machine learning data, and this is something I'm very keen to get your thoughts is, some of the things that you already mentioned about the feedback mechanism, the impact, scoring of the impact, or even the mental health to work. Potentially data, AI, machine learning can play a big role. How do you see, for Save the Children, I presume it's quite an important topic, but where do you see that the first few areas that you as an individual, also as an organization, want to focus and use these technologies for?
Yeah, look, it's a great question, right? And I think this sector writ large, and we are very much a part of that, has for a long time, I think, underinvested in data and technology, right, writ large. And there are all kinds of understandable reasons for it, but essentially we're really coming from behind. And I think we also have to make sure that we don't translate those opportunities or challenges just in, oh, we just need more apps to do, to whatever, to help more children being born safely or to make sure that kids are not malnourished. Although I do think there is a huge opportunity there to make sure that, diagnostics are implemented more consistently, more efficiently with the use of machine learning, AI, or technology tools that we now have. But it's also about understanding how better to blend technology with some of the analog activities that we've already been doing. I get asked a lot about, if girls in Afghanistan cannot go to school because of the ban, can we all get them online, for instance? And well, first basics. Also, there is still a huge issue around connectivity in countries like Afghanistan, where most kids actually don't have access to connectivity, let alone the devices. So that's one. And B, education cannot happen purely online. It is important to get kids back into school, to get them back into learning. And a teacher and a high school or a primary school principal are not just roles to be disintermediated or disrupted. They have to be seen to be really contributing to children learning and growing up safely and well. So I think the more we can do to augment our interventions with phenomenal abilities that there are, becoming available, I think the better it is. And also being, of course, clear-eyed about some of the risks and challenges, like, online protection for kids. It's fantastic that there is so much more available. We've used technology to help children and young people have much more of a voice. They do campaigning online. Now, how do we make sure kids are not then put at more risk? Because we help them get online, we give them tools and we give them training to be outspoken advocates for things that they care about. How do we make sure we don't put them at more risk and that we put them in harm's way? So both the opportunity side as well as the risk side are things that we have to invest in. We have to get partners in, like yourselves, to help us understand what it is that we don't know and augment the capabilities that we don't have, but also point us to, look, you could do your work much more efficiently and effectively if you were to embrace some of these new technologies. And in that sense, there's also a real cultural journey for us to undertake. We do not think mobile first when we think about, how do we make sure all the kids here are food secure? How do we prevent maternal mortality in this area? Our thinking would not be digital first. And I think we have to find ways to help our staff to think more in that way without saying that all of it will be done through apps.
Yeah, so there are 2 points that you actually raised. One is, of course, how can you use these technologies to reach to more people or kind of effectively give more support to these people? But it's also, I think, how the technologies can be used to improve the internal working of an organization. How do we kind of have better feedback and start tracking this kind of feedback improvement? Like what you right in the beginning said very clearly, that the difference between working in a corporation and NGO was this very clear way of knowing the effect, not very clear sometimes when you work in NGO. So that's where I think technologies like AI, machine learning data can also help a lot.
I agree. Look, I still personally would love to have the technology is there, right? The technology is actually not the rocket science part of it. It's more the anthropological question. How do we get that to work? So, for instance, if we could have a TripAdvisor type platform for all of our interventions, where communities would feel safe and heard to say, hey, Save the Children came to my area, working in our community. This is what they've done. We like this. We didn't particularly like this. And we were missing this. And even better if they could say, oh, but the World Food Program did this over here and they did it much better than Save the Children or the other way around. I think that would sharpen our game. It would force us to listen more to the communities we aim to serve. And I would hope that it would give more agency to the people we're actually trying to help. Now, that might be a bit of a pipe dream, but I do think that kind of accountability mechanism that is transparent, visible, easily accessible, efficient, cheap to do, how do we get that embedded in our work? That would still be, I think, that's something I think we should work on and aim for.
Coming back to another point that you raised was about the violence against children. In fact, during my conversation with Kailash Satyarthi, he thought that this is one of the biggest challenge that actually is going to go ahead with access to technology being to more children, and there are more predators who are also have that access now to children. Do you see this also kind of one of the biggest focus areas for Save the Children, or do you see that effect already for children around the world?
Look, I agree. Child protection or abuse, violence against children is the single biggest issue for kids. The estimates are shocking there. And of course, millions and we think over 1 billion kids experience violence in their lifetime, in their childhood. And of course, again, the long-term effects of that violence, whether it's child marriage, whether it's domestic abuse, whether it's child labor, whether it's living through a war zone or through conflict, all of those things are a form of violence against children. And I think children living in institutions is one of the largest single topics affecting kids. It's also one of the areas that's probably the most underfunded if you compare it to things like education or healthcare, because it is sometimes so invisible, right? It happens in a school or in an orphanage or in a home. So people can't see it. And again, quite often the impacts are not actually physically visible. And the activities that you can do to prevent or respond to it, helping communities be better parents, helping teachers be better teachers, helping governments to see that there is a better way to care for kids without putting them in an orphanage. Those things are sometimes also quite invisible. We're not building something that you can see or put a picture up of. We're not feeding kids that you can see. We're not giving them a vaccination, right? So it is often deeply personal. It is working with pediatric psychologists. It's working with social workers. It's making sure that there is proper case management. It's making sure that there are child protection systems in countries that are actually working. It's trying to figure out ways to get kids out of orphanages, put back into external extended family care or back with their direct family even. So a lot of these things make it, I think, more difficult for people to understand the scale of the problem and also see that there is a real way to prevent these things from happening or to respond to them in a much larger fashion. And I think the online element of it, again, gives us opportunities to spot them or to give children a voice that's heard more loudly. But also, of course, yes, it puts them at more risk. We'll have predators online. There will be untold ways, I'm sure, that kids could be abused online as well as in an analog way. So as with all of our works, I think technology can have a fantastic beneficial impact on our work as long as we mitigate against the risks.
Yeah. So, we touched upon some very important topics. There's so many problems to solve. What I would touch upon a bit before we end was more around, as a CEO of a large organization like Save the Children, what are your thoughts on leadership and what you think makes a good leader?
I think being vulnerable is a good start, because I think as a leader, if you're not vulnerable, I think it's harder for you to actually influence people. I think it is harder for you to be seen to be authentic. I think you have to be vulnerable enough to acknowledge when you don't know the answer or when you need help. And I think the problems that Save the Children and many of our peers, not just in the sector, it's also in the private sector, the problems we're facing or the challenges we're facing as CEOs, or whether you run Unilever or Save the Children, are so vast and so complicated now that it's, if you don't recognize that you need help and great partners, both in your team as well as outside, you're not having the impact that you could have at scale. So I think that level of humility and vulnerability you have to have as a leader. And yes, you need to make decisions. It's if you come into these roles and you struggle to make decisions, I think that's problematic. And not because we always need, my idea or my opinion to win the day, not at all. But I do think organizations sometimes need clarity about what we're going to do and what we're not going to do in the moment. And that doesn't mean you always have to make decisions the fastest, but you cannot have big decisions linger, whether it's about where you work, how you work, which funding you're going to go after, which funding you're not going to go after. What you say no to is almost as important as what you say yes to. The principles that you want to stick to. And they come up all the time, right? The Taliban says women cannot work for NGOs in Afghanistan. We then have to make a call, not so much about what we think about that, because that's a fairly easy question to answer. But the much harder question to answer is, what are we going to do when that ban is upheld, or when we can't get the exemptions that we want? So those are the things you have to be decisive on when they come up. And you can't always plan for these things to come up when they come up. So I think vulnerability, humility, and a certain amount of decisiveness are very helpful. And I would say, lastly, perhaps an ongoing curiosity about, yes, the world around us and the work that you do as an organization, whatever that work is, because I think you always have to ask yourself, what is it I'm not seeing? What is it we're not doing that we should be doing? What is it that we are doing that we should not be doing? And why is it the way it is in this particular part of the world, to fully understand how you're going to deal with your work in that area.
So thanks for a lot. That I actually have to learn also a lot from being how to be a good leader. So before I end, I have one final question, and it's about success. I heard you defining success as achieving more than what one thought is possible. So how do you see success for yourself and Save the Children in the next, say, 5 years?
I think, look, Save the Children has put, sometimes people would say, ridiculously ambitious goals for 2030, but we tied them very closely to the Sustainable Development Goals that the world set for itself. We have said we don't want children to die of preventable diseases before their 5th birthday. We do want all children to learn from a basic education, quality education, so not just being in school, but actually learning. And we do aim to see a world where violence against children is no longer tolerated. It might happen, but it won't be tolerated and normalized. And I think, Save the Children is not the only one who can deliver that. Absolutely not. We need global partnerships and engagement and commitment to those goals. So I think we're, on the one hand, realistic enough to say, are we exactly going to see all of that everywhere all the time for all children by 2030 or even by 2050? No, but they were meant as something to aim for, whilst accepting that the exact sort of metric that we can put on that, or the exact indicator that we have for that, isn't going to necessarily show 100% achieved all the time everywhere. But I think if we can get a good chunk of the way there, particularly in a context where certainly a pandemic and ongoing increased conflict and climate change impacts are working against those indicators. Whereas before we actually saw, I would say 3, 4, 5 years ago, we probably maybe naively thought, we're on the way there. We've halved child mortality before the age of 5. We were on our way to get more children, particularly the poorest and girls and other marginalized groups, into school, keep them in school, keep them learning. And of course, certainly the past 3 years, we've seen a rollback of those impacts, not just in the countries that would come to mind, Afghanistan, Yemen, etc., but also in countries like the United States, where the impact of the pandemic has been more acutely felt on the poorest kids, often living in rural communities. So I think we've set incredibly ambitious goals. We're seeing actually headwinds against those indicators. So if we can do a lot to even push back on those headwinds, to achieve larger numbers of kids being immunized, kept in school, fewer girls put into child marriage, fewer kids put into institutions, more children able to advocate for their own rights and to do so safely, I think those things will all be incredibly satisfactory for us to see unfold.
Thanks a lot, Janti. It was a pleasure. I thoroughly enjoyed our conversations. The part of this conversation is not just the talk, but actually without some of the key points that you mentioned with respect to mental health, abuse, the education, effects of pandemic in front of our global community. We have chapters in over 60 countries, so that maybe some of those chapters will take up some of those problems and try to solve those locally. And that's one of the key goal of doing this. And I personally also enjoyed our conversation. Thanks again.
Thank you for listening to Impact Leadership by Omdena. Our mission is to support and promote thoughtful and sustainable leadership with a focus on building solutions to solve some of the most pressing problems of the world. Do not forget to subscribe to our Impact Leadership newsletter on Omdena's website to be notified about new pieces of meaningful content.